Guest on today's show, Deputy Health Officer with the Jackson County Health Department, Matthew Budd. Good morning.
Good morning. Good to see you again.
Yeah, good to see you.
Yeah, welcome back. And today, among the topics, one of Matthew's favorites, STI.
Well, absolutely. I am a nurse, and I do, of course, support our sexual health clinic. And one of the big things with sexual health is, of course, talking about it. And
I was going to say, last year we learned that STDs are now kind of is referred to as STIs.
well, and it kind of makes a lot of sense. So the infection, right? Over 80% of gonorrhea and chlamydia, you have an infection but no disease with it. So you're a carrier, you're passing it on to other people potentially. So it's more of an infection than a disease in that point. So
So you have a social media campaign you're posting about sexually transmitted infections.
yeah.
How to avoid them.
Right, and it's really talking, testing, treating. And especially the people who are most at risk for STIs are young adults, 18 to 25, is of course in Jackson, who have the highest burden of sexually transmitted infections. It's about talking to your healthcare provider, talking to your provider or your partners, and testing and treating.
It's interesting that the STIs are going down in some areas, but they're also at an all-time high in certain areas. And it just seems puzzling to me with the education that, for the last 30 years about sexual health. You think going back to really the Magic Johnson and those big HIV campaigns. It's kind of interesting that it's still such a high.
It really is, and I really can't explain it this year. We've had a couple years of increases in STIs throughout 2020, 2021, and we were thinking it might be just less testing, less access to healthcare providers. But we've had a decrease in chlamydia and gonorrhea, but at the same time an increase in syphilis cases over the last couple of years. And syphilis cases over the last 10 years have been rising pretty rapidly and substantially, especially for heterosexual women.
Are there people that they're just embarrassed that they think they might have something and then they just go to the drugstore and try to self-medicate?
Yeah, and the regular antibiotics we take aren't always effective in treating STIs. So it's really important to get the right STI for the infection. And there's antimicrobial resistance too for gonorrhea and chlamydia. So that's a real risk, is we know that a lot of the antibiotics we used to use 20, 30 years ago are the diseases are now resistant to those antibiotics.
Interesting. And it's not only testing that the health department provides, but you guys provide care.
Yeah, absolutely. So we are very low cost. So it's just $15 to come in, get tested for most STIs. And then we also provide the prescription, though, for free.
Right.
And we can treat partners.
Do you have to know which STI you think you have in order to get the proper test?
No, and most people don't really know, right?
Yeah.
And I will say it's pretty interesting. At our clinic, we're a relatively high-risk clinic, right? Because it's a sexual health clinic. People are coming to us with concerns. But even most of the time, it's less than half of the people that come to us have an STI. So we have a lot of people coming, getting screened, just wanting to be cautious and safe. And we're there for support, education, too.
They think they have one, and then half of them they don't?
Well, they just want to be sure.
Oh.
They want to get tested.
Okay.
They want to make sure that they're not a risk to any partner that they may have in a new relationship.
Probably a different excitement level walking out to the car.
It's like, but then do you tell them what they have? No, you don't have STI, but here's what you have.
No.
No?
No.
No.
We're just looking at the sexual health.
They don't have it.
So next week is National Infant Immunization Month, which I know is a big push for you guys. Talk a little bit about what's going on.
Yeah, infant immunization is really important, right? So they start off life, they haven't been exposed to a lot of pathogens and infections. They have some resistance from their mother's antibodies that help really fight off infection. But after about 6 months to a year, so a lot of the mother's antibodies are now gone for the infant. So those immunizations in early life really help prevent those vaccine preventable diseases. When we think about like whooping cough and pertussis, things that used to be a big problem that now are a lot less common because we vaccinated against them.
What was the latest thing we had? Was there measles?
Yeah.
Did we have a measles?
Somebody had measles.
We've had a few cases of measles in Michigan.
Okay.
So we've had Oakland, Macomb, Washtenaw, and I think we were up to 4 confirmed cases of measles. But we've had some people here in Jackson exposed to those cases.
Sure.
So we, at the health department, monitor for those. And the great thing about measles, if we can monitor and identify who's been exposed quickly, if we provide them the measles vaccine, if they haven't been vaccinated before, it's really protective against getting measles.
What is that disease?
Measles?
Yeah.
So measles is really kind of identified by a rash. A rash that'll start from the head
Okay.
and start moving downward on the body. The other things we'll see kind of as clinicians is spots on the tongue, like
Really?
white spots on the tongue. Very uncomfortable, can cause pneumonia.
Wow.
And hospitalization. And then the thing that I think scares me the most is we think of like long COVID, right? People who still have symptoms years after.
Mm-hmm.
For measles, we have individuals, we know that 10 years later they can develop meningitis.
Oh, wow.
Oh, wow.
Amazing.
And you could die from it.
You can.
And then we've got other things with the warming weather, Lyme disease, ticks, and mosquitoes, and encephalitis. I mean, it just doesn't stop for the
Right.
health department.
I think it's fun. We could talk about bugs, bats, and bites later this summer, right? So.
Yeah, I saw something yesterday. There's a immunization for Lyme disease for dogs,
Really?
but not for humans.
That sounds maybe like snake oil to me.
Well, I'm not too sure, right? We have the tick the preventative and things
Right.
like that for them too. I'm not sure where that lies.
it's
I'm not too
interesting.
sure for dogs, to
It's
be honest.
interesting.
I'm curious, getting back to STI Awareness Week, what do people need to know about the clinic? Like, what's the process? Do you
good
have,
question.
your privacy and your, and all that?
Yeah, so that's a great question. Thanks very much. So you can come to the health department. Our sexual health and immunization clinic is open Monday, Tuesday, Thursday, and Friday. We're able to take clients in. We do have private rooms. We're bring back people, and then a nurse talks to them about symptoms that they may be having, and we're able to conduct testing. We have a couple tests we can be done rapidly at the clinic, and then a few more complex tests that we might send up to the state lab for testing of urine in that case. But it's all private, it's all with the nurse, and we keep things as confidential as absolutely possible, of course.
Yeah, so you didn't want to run into someone you knew at Buc-ee's. It doesn't sound like you're going to run into anyone you know.
Yeah, I think it'll be a little different. Yeah,
Yeah,
for
a little
sure.
different.
Yeah, a little different.
But you won't run into someone you know because it's private, confidential, and
And you're here to help.
There is a waiting room,
Right.
but it's relatively limited.
they don't know what you're waiting for. You could say,
Oh,
I'm here
absolutely.
for
I'm here for my flu shot.
I'm
immunization.
here to pick someone up for lunch.
Yep, absolutely.
We have a lot of people come in, and these are some of my favorite people. We have a lot of family members that come in, grab condoms, and say, these are for my kids, or
Yeah.
these are for my friends, or
Yeah.
I like to keep some at my home in case
Yeah.
somebody's over and I want to feel like I should hand them these. So we have quite a few people that come in about once a week and grab some stuff and say, this is for other people I know.
That's what they're for.
Yep.
We're having a party. We've got chips, dips. Well, we appreciate all the work that you and everyone at the health department do to keep us healthy and safe. Thanks so much for coming in today.
Thanks for having me.
Thanks, Matthew.
Matthew Budd is Deputy Health Officer at the Jackson County Health Department. More of the morning show after this.